I'm Darcy Strickland, your host for Women's Night In, and thank you for joining us. Because of the COVID-19 pandemic, we're coming to you virtually for this year's annual fundraiser and breast cancer awareness event. We're going to share uplifting stories from breast cancer survivors in our community. We're going to introduce you to some of the programs and services offered at Lexington Medical Center, and we're giving you the opportunity to support some of the important work being done for cancer patients. So let's get started. Women's Night In is brought to you by the Lexington Medical Center Foundation. Tonight, we celebrate and pay tribute to those who fought breast cancer as we bring greater awareness to the treatment and prevention of this disease. 100% of the proceeds of Women's Night In benefit the Crystal Smith Breast Cancer Fund, which provides support for patients undergoing treatment at the hospital. Breast cancer is the #1 type of cancer treated at Lexington Medical Center. The hospital's nationally accredited breast cancer program treats more than 300 patients and performs more than 8,000 life-saving mammograms every year. We're pleased to introduce you to some of the people involved in the fight against breast cancer and the patients who continue to inspire them. You can help us support breast cancer patients today and throughout the month of October by making a donation to the Lexington Medical Center Foundation. It's simple. Just text LexMed to 44321 to make a donation of any amount. Donate $25 and you can upload a photo of your loved one to a tribute page honoring breast cancer survivors. Donate $50 or more and you'll receive a special breast cancer awareness celebration kit. Thank you for helping us provide hope to these individuals when they need it the most. I'd like to introduce you to a physician who works with breast cancer patients every day, Dr. Beth Cerroti-Smith of Lexington Radiology Associates, a Lexington Medical Center physician practice, and this year's presenting sponsor. Dr. Cerroti-Smith knows the importance of early detection and its impact on survival.
1 in 8 women in their lifetime will be diagnosed with breast cancer. And that really hasn't changed for many, many years. So what that tells you is we really can't prevent breast cancer. The best we can do is early detection. Breast cancer screening recommendations is still women at age 40 should begin routine annual screening. Certainly sooner if they're having a breast problem or if there's a family history of breast cancer in a mother or sister or daughter. So what we usually recommend is beginning at age 40 or 10 years younger than their mother or sister was at their age of diagnosis. What's important about detecting it early? Number one, when they're smaller, there's less chance of it spreading elsewhere in the body. So it's more curable the earlier it is. The earlier we find it, the more options someone has. So they might be able to have a less extensive surgery than they might have if we found it later. They may have additional treatment options regarding the additional therapy, like the medical therapy and the chemotherapy or the hormone therapy or things like that that we talk about. We are dedicated to our quality imaging throughout the entire system, and we're really proud of what we are able to offer our patients. We have at Lexington Medical Center the state-of-the-art technology. We have the, as far as I know, the best, most caring staff that we could ask for. in both the technologists who initially are, the ones that start the process, through our clinicians, our physicians, our support staff, such as our nurse navigators. There is nothing that you can't get at Lexington Medical Center that you would have to go somewhere else for. But there's nothing that pleases us more when we see patients coming in for their routine mammogram and we hear breast cancer follow-up from 2002. We cheer them on when they come in for their mammogram and we're able to tell them, yep, it looks good again. And we celebrate, 5-year mark, 10-year mark. We try and make a really big deal of it. But it means a lot to us because we appreciate our patients. We appreciate the women that give us their trust. I always say this to people, we didn't put it there, but we're gonna find it and we're gonna get this patient the best care they can get at Lexington Medical Center.
I can't wait for you to meet this year's survivors and hear their inspiring stories. Before we meet our first survivor, I do want to clarify that some of our video was shot before the COVID-19 pandemic. So you'll see some people not social distancing or wearing masks. First up is Linda Hill, whose faith in God gave her the courage she needed to face breast cancer.
It was on a Monday that Kelly called me and gave me the news, you do have a breast cancer and it does require surgery. I have been blessed that I've always been very, very healthy. And this was devastating news, as it would be for any woman. I was absolutely crushed, I was shocked, I was frightened. I experienced every emotion that you could have. When I finally stopped crying on that phone call, I said, Kelly, there are 2 things that I need from you. Number 1, I need the very best that you can give me. And number 2, I need immediate help. The next day I was in the surgeon's office. That was Dr. Barwick, who was my surgeon. Having the conversation with him, he was very compassionate. One of the first things I said to him was, I might become very emotional because this is all so new and I'm having trouble with it. So if I start to cry, please bear with me. And he said, if you have to cry, cry. We will cry with you. I had a very godlike experience on my day of surgery. When we were en route to Lexington, about a mile from the hospital probably, I started to cry. And I said to my husband, I am so sorry. I thought I had hold of all of this. I thought I was in command. I didn't know I was going to cry. Linda, it's all right, it's all right. We're almost there. Everything's going to be fine. I suddenly was very nervous, very upset. We walked into Lexington Medical Center, into the main lobby, and as we were walking, I felt a warmth around my shoulders. It was an actual physical feeling. It was as though someone had put a warm shawl around my shoulders. I had been walking thinking, Linda, these are your steps. This is the beginning of your journey. You can do this, you can do this. In that moment, I felt like I had been touched by God. I felt that from that moment forward, God was with me in my steps, every step of the way. My attitude from that point on was, I can do this. I can do this. This is my battle. I am going to win. Cancer is not going to take me now. This is mine and I've got it. I can't speak highly enough about Lexington Medical Center. Their services, the coordination between and among departments as I walked this journey. It seemed like the left hand always knew what the right hand was doing. I was just amazed. There was never, you have to wait so long to do this. It just flows so very, very well. The staff is outstanding. They're compassionate and caring. The experience was just, it was just remarkable. I cannot speak highly enough of every person I've come in contact with. Having gone through this journey, thank you. I suppose I have a deeper appreciation for everything in general. One down. I love my husband dearly. I love my children, grandchildren, my friends dearly. My appreciation is deeper than it was before this journey because I know how kind and caring people are. I am a 15-month breast cancer survivor. I know that I've had this journey and I'm fine right now, but I'm also aware that my cancer could return at another time. If that were to happen again between now and then, I'm going for it. I don't live in fear of it. I have time on my hands. I want to just live.
Everyone expects when they come to an excellent hospital that they are going to get excellent medical care. And Lexington Medical Center is no different from that. We provide the best in medical care. The role of the Lexington Medical Center Foundation is to provide those extra things that would help a patient's experience be just a little bit better, just a little bit easier. And so we provide hope. We provide programs that enhance the outstanding care that the patients already receive here. We just look for those things that we can provide that are a little extra. We are hoping that everyone who sees this program is compelled to help us in our mission to provide hope to our breast cancer patients. The Crystal Smith Fund not only funds patient needs such as wigs and prostheses, different programs that we provide free of charge through the Lexington Medical Center Foundation for these patients, but we also are able to work on cancer prevention. Cancer doesn't stop for anything. It continues on, the needs continue on, and we are there to step in and help them whenever they need it with whatever their needs are, and that they receive the best care available anywhere. We don't want to lose sight of the fact that the reason we're here is to celebrate those survivors that have been survivors from day one. You're not a survivor when you've beat cancer for 5 years. You're not a survivor when you finish your treatment and ring the bell. You are a survivor from the day you're given that diagnosis, and you make the decision along with us that we are all in this fight together, because none of our patients are fighting this alone. It's our fight too.
Kelly Jeffcoat is a breast cancer survivor and a Lexington Medical Center employee. In her role as a nurse navigator, Kelly works with breast cancer patients at the hospital every day. Her personal experience makes her uniquely qualified for this job.
This is absolutely where I'm supposed to be. It's my mission, it's my calling. I don't feel like it's a job. It's just what I'm supposed to be doing. My job as the breast cancer nurse navigator is to just basically pick that woman up from the time of diagnosis, sometimes even before diagnosis, and just navigate, lead her through the medical system. I don't ever take lightly when I pick up that phone and call that woman and tell her she has breast cancer. I always pray for them before I make that phone call, and because I know that is a defining moment in their life, that their life can never be what it was before that phone call. And to just be able to love on and encourage them and let them know that it's going to be okay. And I don't mean it's going to be okay, I can tell you that you're going to be cured from this breast cancer, but I just mean that you are going to get what you need. You are going to be in excellent hands through this process, and that we are going to guide you every step of the way. You know, I tell women almost daily, you know, that blessings come from these experiences in our life, and many times they look at me like I'm crazy. And I had a patient tell me yesterday, you know, and she's gone through a lot. She said, this has been nothing but blessing after blessing. And you just see the preciousness of life. You know, I've got 5 grandbabies now, you know, that all those years ago, you know, there was that part of you that thought, well, gosh, you know, will I ever see this happen? Good, positive things come from those experiences, you know, when you look back. You know, when you're in the middle of it, you don't see it. But as you look back, you just see blessing after blessing after blessing. When I was diagnosed, I was stage 2B. I did a surgery first, and then I did chemotherapy and radiation. I listened to what I had been telling my patients for years. I did exactly what I'd been telling them, and it worked. It helped. Like, I had seen so many women walk that path before me, and my thought was, you know what, if they can do this, I can do it. And you do. It is a humbling experience for you. You know, you know, as a wife, as a mother, as a sister, you know how loved you are. But boy, you know, this just really magnifies it and just puts it in your face. Before I was diagnosed, I really never considered myself to be all that strong. But after that experience, I am dang strong. And I know that there's nothing that I can't handle. And that's what I want. That's what I want all of these ladies to know and understand, that they can do that too. I'm kind of like a mama with a whole lot of children, and I just look at all of them with just great pride for what they've gone through and how they've come out on the other side stronger and better than before. Every day is special, and that even, you know, whenever you're in the midst of craziness and life gets you know, busy, just to be so appreciative of the moment, you know, and really living in the moment, because that's all any of us have is today, and just doing the very best you can today.
By sharing their stories, this year's survivors offer hope and encouragement to others, and they bring critical awareness to the most common type of cancer in women. Will you help support survivors like these by making a donation today? Text LexMed to 44321. Every dollar supports the Crystal Smith Breast Cancer Fund. Now let's hear from the president and CEO of Lexington Medical Center, Todd Augsburger.
For nearly 50 years, Lexington Medical Center has provided quality health services that meet the needs of our community. Our leadership is committed to deliver the expertise of world-class physicians and clinicians with access to the very latest technologies and treatments in the fight against breast cancer. Our cancer programs are certified by the American College of Surgeons Commission on Cancer and the National Accreditation Program for Breast Centers. Participation in these quality initiatives and the dedication of our cancer program staff and support teams makes these accomplishments possible and helps us stay well informed about advances in oncology. We also strive to provide collaborative care for our patients. Whether clinical studies are housed in radiation oncology, medical oncology, or surgery, our patients benefit from a diverse team of doctors, nurses, cancer registry staff, and research personnel who work together to help them achieve the best possible outcomes. As the only locally owned, independent hospital in our community, we are dedicated to taking outstanding care of our friends, families, and neighbors, and we will never waver from that commitment.
Alicia Milling loves the water and spends lots of time on Lake Murray with her husband, who was a key source of strength during her treatment.
The day I found out I had cancer was kind of a blur now. Shock, denial, It was a rough day. But that day we laid out a plan of attack, and we were going to go after this aggressively and as quickly as we could. Dr. Stillwell and I, we hit it off pretty quickly. She listened to what I needed, and she learned very quickly that I wanted my news quickly. Didn't want it sugar-coated. I wanted it in layman's terms so I could understand what I was up against. And she did exactly that. I had a lumpectomy 4 working days later. And the surgery was a great day because that's when I knew the cancer was gone. 4 rounds of chemo were followed up by 34 rounds of radiation. I didn't realize how taxing that was going to be. Going every day, 1 o'clock, show up to get radiation. But I had a really great team. The people that are closest to you in your heart, they don't have to be right here in Columbia. They get me, and they made sure that I knew that I was loved. There's a group of girlfriends that we still stay in contact from high school. So every day to let them know how I was doing, we had a count up to day 34. And so I started making these little posters. They were all kind of comical, counting up to day 34. But that kept me connected to my support group. Craig and I, like I said, we've been married for 35 years. We went to high school together. We were sweethearts, buddies, classmates. He's my biggest supporter. He's my biggest fan. Every time I look behind me, there he was. And on the days that I could not find my strength, he gave me his. Cancer was bad enough by itself. I'd never do it without him. There's always a reminder of what you went through. But you learn from it, and you keep moving forward.
Well, this is our 3rd year for the Jim Hudson Automotive Group sponsoring the Model Luncheon, and it's just a delight for me to be able to come in and meet the women. And today it was very special. Even though everyone was wearing masks, you could still see just what they're going through and how real this is. And hearing words, I think, of encouragement to know that there's someone out there praying for them, that we've come alongside of them and be on this journey with them together. We wanted to present these ladies with a courage coin that has a scripture verse on it, just for them to know that, again, we're thinking about them and that they have this coin, hopefully just as a memento, something that they can hold on to. Maybe if it's in a treatment, if they're going through something difficult during the day, that it would give them peace, that it would just bring a calmness over them, that no matter where they're at in their journey, that they would truly be at peace and at ease with what's going on. When you can be a part of something and you can meet these women face to face and see them and know what they've gone through and to hear some of their struggles, it's powerful. And I mean, it leaves an impact on me. So I think for me, it's driving me, it's motivating me to want to continue to give, to want to continue to be a part. And we want to be able to see it. We like to make an immediate impact in our area. Women going in for treatment, that doesn't stop because of COVID. So I would just encourage everybody to continue to give generously, and we can make an impact. And I can assure you that the money being given to Lexington Medical Foundation is going to the right people and is making an impact.
Family history is a risk factor for breast cancer, but with Becky Carter, there was no family history. Yet she and both of her sisters developed breast cancer 2 years apart. 3 sisters, 3 survivors.
Both of my sisters were diagnosed with breast cancer in 2017. My dad was debilitating with Parkinson's. My mom had heart issues. My son graduated from college. We lost my husband's brother, and my son got married. So for me, it was such a stressful year. I had noticed an indentation on one of my breasts, but I kind of just put it aside because it was just so much going on. Later on, after the wedding and everything, I noticed that the lump had gotten bigger. And so I went in for another 3D mammogram, and they did an ultrasound as well. And of course, they saw something and did a biopsy. And I was diagnosed with breast cancer November 13th in 2019. With my sister's history, I really prayed a lot about going ahead with a double mastectomy. And I really asked God for wisdom, and I went ahead with the double. And it ended up that I had cancer in that breast too. So I'm just so thankful. I just knew and watched what my sister went through, and so it made me feel comfort that I can do it too. Staff was amazing, and I think with it being COVID, Dr. Wells, he's like, you're healthy. We want you to walk up those stairs. Don't get in the elevators, which I did. So when I would walk up the stairs to treatment, I would sing the Lord's Prayer. It's amazing how good you sound in the stairwells. And on the way down, I would sing It Is Well With My Soul, and I did it every time, even after the last treatment.
How you doing today, man?
Edwin at the front doors, who was the security guard, had such a huge heart. He would greet me every morning. He knew how many treatments I had, so every time I'd come out, he'd count down. You have 5 more, you have 2 more, you have 1 more. And he just distributed so much goodness of God, a complete stranger. So I appreciated that a lot. And both my doctors, I loved that they put their faith first. Each one of them prayed over me. And so they realized that their gift is from God and that He is the ultimate healer. My sister and my daughter and my husband were a great help to me. Yeah, a lot of people don't have a spouse who's loving and supportive, so I just feel very blessed. I've been through cancer and it wasn't easy, and I'm just grateful now for every single day.
Thank you so much for continuing just to work in our lives, God. So thankful, God, that what this story is going to do for those hearing it, God, that you're still alive, that what you've done for my mom, you can do for them as well.
Proceeds from Women's Night In support the Crystal Smith Breast Cancer Fund. Crystal Smith worked at Lexington Medical Center for more than 20 years before her battle with breast cancer ended, leaving behind 3 young children. Her daughter Shelby, now 22, plans to pursue a career in medicine, inspired by her mother and a dream of helping others.
So I'm Shelby Smith, and my mom was Crystal Smith. There was a fund started for her at Lexington Medical Center. It's called the Crystal Smith Breast Cancer Fund. She worked there for 22 years and she was treated for breast cancer there. And it provides a bunch of different things for breast cancer patients, post-surgical mastectomy kits and wigs, and it's affected a lot of lives. Growing up, I was always told stories about her, and my dad always talked about the fund and how it does all these fun things, and it really helps a lot of people. So I think that throughout my life, it's kind of made it an example of how to give back to your community and how to make sure to, look out for everyone at the same time. So I think that that kind of has driven me into the different avenues of where I've gone and what I want to do, just because you see this impact that it can be made, and that kind of was made through my family, my mom, and my dad, and the rest of them. But so it's nice, like it's a nice kind of breath of fresh air, like, oh, I get to continue that and I get to kind of live up to that too. So it's it's fun to be involved in it. I feel like she was always a fighter through it all. And through her fund, there's hope, and it brings people together and they get to kind of celebrate each other. I've learned from the survivors that I met a few weeks ago, and just through the fund in general, and through participating in the Women's Night Out events, that people are they're so willing to share their stories and come together and support one another. And I think that is very important in either treatment or when you have any diagnoses, you're able to kind of come together. And I think that that is a big thing, that it's important for people to feel supported. And I think that the Crystal Smith Breast Cancer Fund does that in a way with providing wigs and surgical kits and all that stuff, but it also provides an outlet for people to kind of celebrate other people and their fight, and I think that's very inspiring. So I think that if my mom was here today, she would be extremely proud of the things that the foundation have done for the fund, and how the survivors and everyone that's involved in the event have just really come together to lift everyone up. It really is joining people together, and I'm sure that she would love to know that that is something that she did in a way. Mama would be super excited for what's happening, what's going to continue to happen.
If you've enjoyed the messages of hope you've heard so far, you can support these survivors and others fighting breast cancer by texting LexMed to 44321. Every dollar supports the Crystal Smith Breast Cancer Fund.
The Campaign for Clarity was a tremendous success for us with the foundation at Lexington Medical Center. And the focus of that campaign was to raise $3 million in 3 years to replace every mammography machine across the continuum of care in Lexington Medical Center. And we now have those machines all across our network, as well as in our mobile mammography van, to identify as early as possible the existence of any potential cancer in and around a woman's breast. This is so important so that they can receive care earlier on, which greatly increases their ability to eradicate this terrible disease from their body. So while we have met that campaign goal, we are not sitting on our laurels. We have great momentum now, and we're moving into the next phase. We want the community to be able to come in and get the necessary screenings to catch any potential cancer in their body early, so that we can then move them quickly into treatment. And that's the kind of organization that I want to be a part of. The culture of Lexington Medical Center exists nowhere to my knowledge. The way in which they care and communicate with families and patients, the way their staff works together. Every patient's story is exactly what invigorates us on the board to do our very best, to work as hard as we can, and to make the commitments that we do to ensure that every woman has that opportunity to become a success story.
We are sitting here in this lovely boutique called Becky's Place. Becky's Place is unique to Lexington Medical Center. There's not another boutique like this associated with a hospital in the Midlands. So cancer patients can come in here and shop. They can do everything from being fitted by certified fitters for a prosthesis, for a wig. They also can find scarves, head coverings, hats. And then we also are a Vera Bradley distributor. And so not only do the cancer patients come in and shop, but visitors come in and shop, and the hospital employees do as well. It is wonderful for the patients to be able to have it on campus. We have private dressing rooms for them, and the staff here makes a point to make everyone who comes through that door feel like they're the only person in the world that's here, that they're taken care of, and they make them all feel special.
When Marlena Hawkins went through cancer treatment, she gave herself the nickname Wonder Woman. And it's easy to see why. She uses laughter and friends as her secret weapons.
My mom would say that I've been a designer my whole life since I was a little kid. I just got into it because I've always liked art and drawing and design, so I've always known what I wanted to do. The day I found out, I was really tired that morning, and I called my boss and I said, I'm gonna be a little late for work. And I kind of rolled over in bed, and my hand landed directly on it. And of course, I was awake then. I wasn't tired anymore after that. And I just grabbed my phone and I immediately made an appointment with my general practitioner. And he got me in that day, and he said, yeah, I feel what you feel. It feels like a lump. Let's get you in for a mammogram. When I found out what my treatment plan was going to be and I found that I had to do chemo, I immediately called my friend Monikia. She had been through the process herself a few years before. Her advice was never get up on treatment days and not feel beautiful. I would just go in and just sit down in my throne chair, as my nurse Mary would call it, and it just made me feel better about my process and made me feel better about going. This journey completely, it changes the way you think about life. I think laughter indeed is the best medicine. The friends I have are silly and vibrant, so we're always laughing about something. People are going to remind you that you're beautiful or that you're important and that they love you. So definitely keep people around you and don't do this by yourself. My husband and I got married May of 2018. Later that month, found out we were pregnant, and we lost the pregnancy in June. And the very next year was the year I found out I found the lump. So it's like, Lord, I waited so long to get married, and now we have this issue, this burden almost. And the message I got from him was, it's gonna be fine. You're gonna be okay. My husband he's been a rock, and my family has been rocks. So our marriage is, we say, is fire tested. When I started my process, I, of course, like every woman, went online to find other people, put in some hashtags to find other women, and there was one woman who responded. She had a Wonder Woman shirt made, and I have always been a big fan of Wonder Woman since I was a little kid. So I was like, well, of course. And so I kind of redesigned the logo and put the pink ribbon in the middle of the W. Most of these women pages had something to do with fight in the title. And I was like, that's it, Wonder Women Fight, because we do. Ringing the bell was exhilarating and like this huge weight lifted. You feel the lifting as soon as you ring that bell. Such a burden lifted, such a burden lifted. I got through losing my hair, I got through chemo, I got through surgery. I can get through anything. Like, there's not anything that I can't get through.
God did it again. Yes, He did.
We hope you've enjoyed these inspiring stories and that you'll consider making a donation to the Crystal Smith Breast Cancer Fund. Your contribution can make a big difference in the lives of cancer patients in our community. Thank you for providing hope.